beautiful day for a nurse. Would you be mine? Could you be mine? It's a nursey day in this operating room, a nursey day for a surgery. Could you be mine? Would you be mine? I have always wanted to have a nurse just like you. I've always wanted to work in an OR with you. So let's make the most of this beautiful day. Since we're together, we might as well say, won't you please, won't you please, please won't you be my nurse? Welcome to my neighborhood. I'm Angela Allen, and I'm a registered nurse on the cardiovascular operating room team. I'm here to talk about my professional identity and future role as a BSN prepared nurse. I started working as an OR over 24 years ago. I have worked in many ORs and in all the surgical specialties like transplant, orthopedics, neurology, peds cardiac, but now I work exclusively in adult cardiac surgery. I believe any nursing practice should involve having the integrity to do whatever you can to the best of your ability to provide learned, holistic, and instinctive health care to all individuals and our community with unbiased equal measure. Our patients are human beings, and each one is to be respected and treated with dignity, regardless of their race, ethnicity, gender, sexual orientation, religion, or any other defining characteristics. That is especially true working in the perioperative setting. In cardiac surgery, I take care of patients when they are probably feeling extremely vulnerable and afraid. So I strive to meet and exceed those expectations as a part of my personal nursing practice every day. Over the years, I have been a part of the training process for many new nurses. One thing I always tell them is to create and exercise good habits in their practice. One of the mantras I tell them is, if you are always doing the right thing, you are never doing the wrong thing. The best way to do that is to follow evidence-based practices. In the OR, our practice policies are evidence-based, such as preventing surgical site infections, preventing retained surgical objects, or preventing skin injuries related to positioning or electrical cause. OR nurses, we also provide emotional support and comfort to our patients and their families. If I get the chance to meet a patient's family, I look them in the eyes when I tell them about what their loved one is going through and offer them the chance to ask questions. I also explain to them how I will keep them informed of what's going on every 2 hours during the patient's surgery. When a patient comes into the setting, it may be overwhelming and frightening. I do everything I can to provide a sense of calm, safety, and security for my patient by placing warm blankets on them, holding their hand, and explaining what we are doing in a way that they can understand. When a patient is receiving anesthesia, OR nurses must be strong patient advocates, acting with decency and ethical values on behalf of a patient that cannot speak for themselves. If you can imagine, the OR nursing specialty is as challenging as it is rewarding. Once I complete my BSN, I hope to transition into a position that still allows me to utilize the skills I have gained during my career, while also taking on greater responsibilities. It might mean leaving the clinical realm of nursing, but the opportunities for advancement allow for a broader impact on systems that affect patient care. I can envision myself as an OR educator teaching new RNs or experienced RNs that are new to the operating room. An educator is also responsible for annual training and competencies for all OR staff. Another option for me is to move into management. That could be as an OR manager or for a department that supports the OR, such as materials and supplies or the sterile processing department. I have already applied for the position to become a service coordinator for the cardiovascular, thoracic, and endoscopy services where I will be responsible for ordering equipment and supplies for those services. And perhaps when I complete my BSN, I can become the manager for that department. There are so many things to love about being an operating room nurse, and there are so many opportunities for advancement. While I have mainly talked about this in the hospital setting, there are even more options out there in day surgery centers or specialty clinics with procedure rooms. When we all reach a certain age, as I have, we may have certain regrets about our choices in life. However, I have never regretted becoming an OR nurse. If you have ever considered this specialty, please give it a chance. You may find the challenges and rewards match your current professional goals, and you never know how far it may take you in your professional journey. Thank you for watching, and take care.